Welcome to Transcend Awards. Infection controls and contingencies. Prioritize safe practice. Your learning objectives are to understand infection legislation and regulation, to understand infection policy and procedures, to understand the employer and employee duties. Once you know these, you can take positive action to prevent, mitigate, and manage the effects of an incident or outbreak. The law. Definition of legislation and regulation. Laws are rules that govern everyone equally, and all citizens must abide by the law where it applies to them. Legislation is a law or set of laws proposed by government and made official as an Act of Parliament. Acts of Parliament may also be generalised for all people and all sectors. The Equality Act 2010, the Human Rights Act 1998, for example. Acts of Parliament may also be related to specific sectors, such as the Education Act 2010, the Health and Safety at Work Act 1998. Acts of Parliament are often classed as umbrella legislation, supported by regulations and created by specific government agencies. Regulators are then able to enforce the law in their particular field of expertise. Regulations affect those who deal directly with the agency who is enforcing them. These are most relevant to organisations and job roles that are required to adhere to those regulations. Definition of statutory guidance. Guidelines are designed to articulate legislation and regulation in a way that people can understand and comply with. Guidelines can be statutory and enforceable, or non-statutory and not enforceable. These can be for the general public to help them understand legislation and enforced by the police, or they can be for specific sectors, employers and job roles and enforced by the regulators. Here is an example. Department for Education, statutory guidelines for school. Ofsted. Failure to abide by these can impact on a school's outcomes and reputation during Ofsted inspections. Both statutory and non-statutory guidelines are easy for regulatory bodies to adapt to, rather than changing overarching regulation, and these are continuously updated for relevance. You may ask yourself, why do we need non-statutory guidelines? Is it the law, and do we have to abide by it? Let's have a look at an example. Definition of non-statutory guidance. During the Prime Minister's first televised statement to initiate quarantine for COVID-19, he said, "You must stay at home." The rest of the statement was carefully written to confirm what would be enforced. He said, "People will only be allowed to leave their home for certain purposes, and police will have the powers to enforce the rules." Due to the speed of the spread of the pandemic, the Prime Minister's statement was needed for public safety. However, at that time, there was no legislation to support the statement. This means that it was non-statutory and not enforceable guidance. Whilst the guidance was non-statutory, you should recognise that as an ethical citizen, you had a duty to comply. The televised statement 3 days later was every bit different once legislation had passed. Police now have the powers to enforce the rules. The guidance had become statutory. The guidance has since been regularly updated throughout the virus to ensure currency and relevance and to keep people safe. To summarise, due regard must be paid to all legislation, regulation which is statutory, and non-statutory guidance as absolute best practice when dealing with infectious disease. Health and safety legislation. The Health and Safety at Work Act 1974 is the primary piece of legislation known as the Umbrella Act, covering occupational health and safety in Great Britain. It is underpinned by a large number of safety regulations and sets out the general health and safety duties which employers must have towards employees and members of the public, employees must have to themselves and to each other, certain self-employed must have towards themselves and others. The legislation requires employers to appoint a competent person to oversee the health and safety in the organisation. The competent person must have knowledge, skills and experience. This must include a sound understanding of health, safety and risk assessment practices, in addition to an innate knowledge of the operation. The senior management or leadership team are often selected to oversee health, safety and risk assessment, although an external source can be subcontracted to do this. Health and safety regulation. The Health and Safety Policy should refer to the Health and Safety at Work Act 1974 and all other relevant safety regulations, which impacts on the organisation, its employees and its stakeholders. Those that are most relevant to all employers are confirmed here. This is not exhaustive, as there is a large number of other regulations in health and safety which must be abided by, dependent upon the operation. The Management of Health and Safety at Work Regulations 1999, the Workplace Health, Safety and Welfare Regulations 1992. Employers are also required to have in place an infection control policy, which should reference the regulations that directly impact on their operation. These might include the Public Health Control of Diseases Act 1984, the Public Health Infectious Diseases Regulations 1988, the Health Protection Notification Regulations 2010, the Control of Substances Hazardous to Health (COSH) 2002, the Reporting of Injuries, Diseases and Dangerous Occurrences (RYDOR) 2013. Organisations associated with food must adhere to a number of food-related regulations to prevent contamination. Health and Safety Policy. The Health and Safety Policy must show commitment to a legal and ethical approach to health and safety. The policy must confirm responsibilities for the overall health and safety and those allocated to specific areas and individuals. The policy must outline the approach to the organisational and event-specific risk assessment, controls and safe operating procedures. The policy must outline arrangements for workforce communications and training associated with health and safety. The policy must outline the health and safety performance review approach designed to demonstrate compliance with health and safety standards. Infection Control Policy. The infection control policy and approaches should be very different across every work environment. The policy must be relevant to the environment and its stakeholders. For example, a GP surgery, a school and a leisure facility would all have very different approaches to infection control. The risk assessment procedures should align with the general health and safety approach and with the infection control safe operating procedures. Employers should communicate policy to employees, and these should be complied with. This includes getting to know the regulations and monitoring the statutory guidances, especially when they are constantly updating during a pandemic. Infection risk prevention. Organisational risk assessment must consider the infrastructure and every operational area. Event risk assessments must also be recorded for events off-site and any higher risk activities. The infection risk assessment must consider all scenarios where infection may be transmitted in the organisation. Infection hazards must be identified and the people who could be affected confirmed, noting that a hazard is anything with the potential to cause harm. Infection risks must be assessed based upon the hazard presented. This is the likelihood that this will occur and should be confirmed as high, medium or low. Infection controls must be put in place to prevent the risk from occurring. If the risk is high, then more robust controls may need to be put into place to reduce the risk to an acceptable level. This must all be recorded and closely monitored. Controls should be supported by safe operating procedures. Infection, risk, mitigation and management. Organisations must have risk scenarios and contingencies in place to mitigate risks in the event of an infection outbreak or catastrophe. This should be supported by emergency operating procedures designed to mitigate and manage infectious disease effects. An outbreak refers to 2 or more people, and a catastrophe might be contamination across the organisation or steps to take during a national pandemic. All employees must be trained to be aware of the organisational controls and contingencies designed to prevent, mitigate and manage infectious disease. Employers must monitor statutory guidelines and take action to maintain compliance. Employees should also do this during a pandemic as ethical citizens and effective employees. Thank you for watching. Feel free to watch as many times as you need or move on to the next part of your digital learning experience on your list.